This is the x-ray of a patient that almost died last week. He was brought in by paramedics with substance intoxication after being found unconscious on the street. After triage, he was placed in a reclining chair inside of an observation area so that he could safely detox, but he was really drowsy and kept sliding off of the reclining chair and onto the floor. So the nurse called me to assess him, and as I was lifting him up off the ground, I noticed that he was drenched in sweat. So we repeated his vital signs and noticed that he now had a fever. His chest was clear when I listened to it, and when I pushed on his abdomen, it was soft and he didn't appear uncomfortable. He literally just looked drowsy and sweaty. So I ordered blood work, and that showed his hemoglobin level dropped 40 points from his last visit, and his white blood cell count was through the roof, suggesting an infection. I then sent him for this chest x-ray, which didn't show pneumonia, but it did show air underneath his diaphragm, which usually indicates something far more dangerous. I sent him for a CT scan, which showed that he had a severely infected colon that had perforated and was leaking stool into his abdomen. I was really surprised to see this result on his CT, so I went back to reassess him, and he was still really drowsy, and when I pushed on his abdomen, he didn't even flinch. He went for emergency surgery later that night. I work in downtown Vancouver, and a big part of my job is treating patients who come in while they're intoxicated. It's honestly one of the hardest parts of emergency medicine because when someone is intoxicated, they won't be able to tell you what happened, their physical exam will be unreliable, and sometimes they can be aggressive or verbally abusive. If they're under the influence, they'll give you the least amount of information to figure out what's really going on. But chronic substance users are among the highest risk patients that we see because they're at huge risk for serious infections and life-threatening complications. So if I had incorrectly assumed that his condition was purely caused by substance intoxication, or if I put too much faith in my physical exam, which showed no abdominal tenderness, I could have missed that diagnosis and he probably would have died. Cases like this should act as a reminder that anyone who treats people with substance misuse or intoxication need to stay on their toes. Because if we become complacent, that's when we start to miss subtle signs that something other than the intoxication is going on. Stay vigilant, my friends. I'm Dr. Jeff, a board-certified ER doctor, and I give you a glimpse into the medical world from my perspective. Follow me to learn more.